Okay, I'm Madison M, and I'm gonna be the nurse.
I'm Madison K, and I'm the patient.
I'm Taylor O, and I'll be filming.
Perfect. Knock, knock, knock. Hi, Madison. I am Madison Maley. I will be your nurse today.
Hi.
Okay, so what's your last name and date of birth?
Chemnitz, January 8th, 2003.
Perfect, so I write that down. Okay, what brings us in here today?
Just a checkup.
Just a checkup? So no symptoms we should be worried about today?
Nope.
And do you have any allergies?
No.
No? No medications that you currently take?
Nope.
Perfect. So present health status, you're currently healthy, no problems that we need to worry about, no diseases? No? You don't have problems breathing?
No.
No. Perfect. And past medical history, no traumas, surgeries?
No respiratory. No.
Well, that's good. And so, the questions that I'm asking are some respiratory and cardiac questions. But
Okay.
first, I'm just going to go over the respiratory as I'm going. And so, family history, no diseases, no cancers.
Nope.
Perfect. And psychosocial, no smoking, no drinking, no. Let me think. Do you exercise pretty regularly?
Yep.
And no secondhand smoke?
Nope.
Perfect. Okay, so now I'm just going to get into the assessment piece of it. So I'm just going to put this on your finger here for your oxygen. And looking at your fingers, I'm not seeing any cyanosis around your fingers or your lips, and skin looks good. And okay, and I gotta turn that on maybe. So we'll just let that do its thing. Okay. So I'm getting 9. Oh, there it goes. Perfect. I got 99 for your oxygen. I also got, I was taking your respirations, and I got 14. Okay, so now I'm just gonna go behind here. Can I have you scoot forward for me? So I'm just gonna check curvature and color, symmetry, alignment. And so I'm just inspecting that. So, and then I'm gonna palpate. So just making my way down. How you feeling? No tenderness or pain?
Nope.
Okay, just making sure to use the pads in my hands. Okay, and everything looks good. No color problems. Everything looks pink, and no alignment, no malalignment, if that's the right word. And that looks good. I don't see any curvature or anything like that. So I'm just gonna check. Forgot the word. Well, we're just gonna be checking this here at the T10. So I'll just have you breathe in and out. One more time. Okay, the expansion looks good. It moved out so evenly and symmetrically, so that looks good. So then I'm just gonna take a listen. Every time I put the stethoscope on, I'll just have you breathe in and out for me, and I'm gonna warm my stethoscope up and clean it. So doing that. And for video purposes, we're keeping the clothes on, but if this were real life, she'd have her clothes off and she'd be in a gown. So here we go. Oh, there goes my name tag again. Okay, just making sure to listen with each breath in and out, and everything looks good. Nice resonance, no timpani or anything like that, so it sounds good. I'm just looking at your posterior and anterior diameter, lateral diameter, and it looks good, no abnormalities. So now I'm just coming in front here, and I am going to check your upper extremities. So I'm just gonna bring my chair up here so it's a little easier. So I'm just gonna take a look and check for symmetry, color, everything looks good. Okay, and I'm just gonna take a feel here. So you let me know if there's any pain or tenderness. Okay, then I'm gonna check your Turner here. That looks good. And cap refill. looks good. And oh, I'm gonna look at your chest here. Just inspect it for symmetry and expansion. Looks good. I'm just gonna take a feel now. So everything feels good and aligned and symmetrical. Okay. And then I'm just gonna take a listen here again in the front. Stethoscope is clean. Perfect. Okay, we're done with your respiratory. So now we're gonna go on to your cardiac. So no cardiac problems, no current diseases, past medical history with the heart, no problems, no cholesterol problems.
Nope.
And same with no surgeries or anything like that.
Nope.
And then for your family, no
problems.
no current, okay. And psychosocial, do you exercise and do all that? And no smoking, nothing like that. I already asked you in that beginning. And health promotion, you come in quite frequently?
Yep.
Every year. Okay. And now I'm just gonna check your carotid pulse here. So I'd wash my hand sanitize one more time. Okay, so I'm just gonna take a look here. I'm not seeing any pulsation, no JVD. Looks good, so I'm just gonna take a feel here. My hands are a little cold, so I'm just gonna do this side first. Making sure to do one side at a time. We don't want to pass out. Feels good. And then I'm just gonna, again, no distension or anything like that, no pulsation. So I'm just gonna take a listen here for any bruits. Sounds good. And then I'm just gonna check your blood pressure here. So I'm just gonna bring this a little bit closer. Move that out of the way. Am I doing good so far? Perfect. That's all right. Okay. Perfect. Okay, I'll just have you hold this for me. It's not on there, right? I think it's good. Okay. So I got 104/70. Is that all? Doing okay? Okay. Perfect. Just put this over here for now. And then I'm just gonna look at your upper arm again here. So just checking for symmetry. Everything looks good. And I'm just gonna look at your fingers here. Cap refill looks good. Skin turgor looks good. I'm just gonna check your brachial pulse here. Feels good. Rate is good. Amplitude is good. It's regular. Same with your radio. Same thing, good. I'm just gonna back up here. I'm just gonna look at your lower extremities. So your femoral is like right in your groin, so I'd look there, but for video purposes. And then your popliteal. Good. And then your posterior tibial. Yeah. And your dorsalis pedis. Okay. Good. And then Capri Bill looks good. Skid turgor looks good. And then before this, I inspect, of course, but I already did that, and she wouldn't have her pants on. She'd be in a gown, so everything looks good. And so I'm just gonna move on to your heart. Okay. So I'm just gonna listen. I'm gonna take a look here, make sure that there's no distension, any pulsations, no. Everything looks good. So, and then I'm just gonna take a feel here. Actually, I'm gonna listen. So I'm gonna just do ape to man here. Put that out of the way. Then move this to the other side here for the bell. And I'm just going to check for a pulse deficit. And I didn't hear any pulse deficit, and if there was, I check a nurse just to clarify. And I'm just going to palpate your apical pulse. Feels good. And I of course check for a pulse deficit, and I did that, and I checked with a second nurse, and everything looks good. Do you have any questions about what we did today?
Nope.
No? Okay, well I think you're good to go. I'd go document my findings then.